All right, so we're at our final couple videos for neck pain here. As you recall, we sort of treated the erector spinae and we treated iliopsoas to sort of take away the increased lumbar lordosis. We gave them stretching exercises to do for there. Then we came up into the thoracic region and we sort of did some techniques to sort of bring the shoulders back and take some of that pain away. And now we're finally to the neck, okay? And so most people's necks, right, remember we sort of talked about everyone's sort of like this most of the day, driving, typing, and I never see kids text. So with those heads forward, okay, so usually into flexion, all right, usually one side is sort of side bent and then sort of rotated to the other side. So that's what we're sort of dealing with most people. And so we're gonna go step by step. I think the biggest thing that we see are these sternocleidomastoid muscles being hypertonic, bringing us into a flexion position. So let's treat those first. All right, so what we're gonna do is, again, if they've been there for a while, those are gonna be very hypertonic and tight, and you might wanna not directly challenge them, you might wanna go indirectly, okay? So if someone's typing for 12 hours a day, they've been doing that for 30 years, directly challenging those might not be the best idea that you can think of. All right, good, relax, good. Okay, so what we want to do then is use reciprocal inhibition and counter strain to indirectly go after it. And what we're going to do is we're going to ask the patient to gently lift his chin back into me. 1, 2, 3, good, relax. So his extensor muscles fire through reciprocal inhibition. Sternocleidomastoids should release. Put in a position of ease. Go ahead, lift back into me. 1, 2, 3, good, and release. Good. We're going to go forward. And push into me. 1, 2, 3, good, and release. Good. And then we're just going to hold in a counter strain position, right? We've got the counter strain points there you can monitor if you need to, right? But it's pretty much that whole sternocleidomastoid that you're trying to get to release. Right. After we feel we get that to release, okay, then we can sort of directly challenge it into a muscle energy. Now, if you want to do each individual one in a counter strain, you're more than welcome to do that. You can do each one individually if you like. Okay. Now, so what we're going to do now is we're going to bring him more, we're going to challenge it directly. So what we're going to do is we're going to have him push into his freedom, which is flexion. So go ahead, bring your chin to your chest. Good, and relax. Good. And then I'm going to take him where he doesn't want to be, into the barrier. Go ahead, chin into your chest. Good, and relax. I'm going to bring him back. Chin into your chest. Good, and relax. Nice job. Passive stretch. Good. And then we're going to also tell him, good, this is something you can do at home. You can just rest this periodically and just let those extensors sort of relax, right? How often is anyone ever like this? So this is a stretch you can do at home to help those SCMs to sort of release. Good. So that sort of takes care of our flexion and extension component. The next video, we'll deal with side bending.